Hi, I'm Carly Weber, and today I will be comparing and analyzing the transferable skills between a deadlift and a volleyball pass. The deadlift is a base lift that is performed by many levels of athletes. Form cues should be followed to prevent injury and perform the skill effectively. Form cues of a deadlift include a bilateral stance, 90-degree hip flexion to start, isometrically engaged core, lower back, and shoulder muscles, with shoulders tucked, down and back, a proud chest with eyes forward and a tucked chin, slightly bent knees, hips back and butt out, and an overhand grip on the bar slightly wider than the thighs. At the standing position of the deadlift, hips should thrust forward into the bar. The bar should also stay as close to the body as possible throughout the entire movement. The pass is referred to as the most important skill of volleyball. Form cues should be followed to get the desired outcome, a well-tempoed controlled pass to the setter, and to prevent injury. Form cues of a pass include a bilateral stance with one foot slightly in front of the other, knees slightly bent, slight hip flexion forward, isometrically engaged core and lower back with no tension in the shoulders/arms when waiting for the serve. Arms should be dangling and relaxed. Muscles and joints used for the deadlift include hip flexor joints, knee joints, quadriceps, gluteus maximus, soleus, adductor magnus, trapezius, hamstrings, spinal erector, latimus dorsi, and abdominals. Muscles and joints used for the pass include hip flexor joints, knee joints, rotator cuff joints, elbow joints, quadriceps, gluteus maximus, trapezius, hamstrings, abdominals, tibialis anterior, deltoid, brachioradialis, and gastrocnemius. The muscle recruitment pattern for the deadlift includes the concentric phase, lifting the weight, and the eccentric phase, lowering the weight. The concentric phase starts with the tightening of the hip flexors, knees, and pelvis joints, which helps the lower body muscles constrict, allowing the upper body to come to a standing position. The quads, gluteus, and hamstrings constrict to pull the body upright. The eccentric phase starts when the hip flexors, knees, and pelvis joints lengthen, which helps the lower body muscles release, allowing the upper body to lower. The quads, gluteus, soleus, and hamstrings release and lengthen to lower the body. The first phase in executing a pass is eccentric. Joints in the arms and shoulders, including the rotator cuffs and elbow joints, should be relaxed, which allows the arm muscles to lengthen. The arm muscles, including deltoids, brachioradialis, and triceps, should be lengthened, which allows the arms to dangle while waiting for the serve. The concentric phase occurs in the ankle joints, knee joints, and hip joints, which stabilize to hold the body in a low stance. Stabilization of these joints allows muscles such as the quads, glutes, hamstrings, abdominals, tibialis anterior, and gastrocnemius to contract. Contraction of these muscles allows for the muscles to hold the body in a low, ready stance. In an eccentric movement, joints such as the ankle joints, hip joints, knee joints, and surrounding muscles are able to release in order to take a step forwards or back, in order to move the body towards the ball. Concentrically, the trapezius and deltoid contract, and the rotator cuff locks for a stable, angled platform for the pass. In this concentric phase, the brachioradialis and triceps contract, and the elbow joints lock to create a firm surface for the ball to hit. Eccentrically, the hip flexors bend to allow the upper body to lean forward to motion to the ball. Concentrically, the gastrocnemius and tibialis anterior contract to keep the balance as the weight of the body has moved towards the toes. Within the same motion, the quadriceps and hamstrings push the body upwards to meet the ball on the pass. This movement is also concentric. Similarities in form cues include hip flexion, slightly less for the pass, knees slightly bent, and isometrically engaged core and lower back, as well as a bilateral stance. The same muscles and joints are used in similar muscle recruitment patterns. In terms of muscle recruitment patterns, the concentric lifting of the weight during a deadlift, where the hip flexors, knee joints, and pelvis joints, as well as surrounding muscles constrict to help constrict other lower body muscles, including the quads, gluteus, soleus, and hamstrings, to bring the body to an upright stance, is similar to a phase in a pass. Concentrically, the ankle joints, knee joints, and hip joints constrict to help constrict the lower body muscles, including the quads, gluteus, hamstrings, and abdominals, tibialis anterior, and gastrocnemius, to help the body stay in a lower stance. Both concentric movements lock certain joints to constrict and contract similar lower body muscles. Similarly, pushing the body up to contact the ball in a pass using gastrocnemius, tibialis anterior, quadriceps, and hamstrings to keep balance and guide the body to an upright stance is similar to the concentric stage of the deadlift. The eccentric lowering of the bar in a deadlift happens when the hip flexors and knees and pelvis joints, as well as surrounding muscles including the quads, gluteus, and hamstrings, release to lower the body as the muscles lengthen. This is similar to the pass when the ankle joints, hip joints, and knee joints release to move to the ball where the muscles are lengthened and joints are free to move. During the pass, when the hip flexors go through an eccentric movement to lean towards the ball, it is similar to when the hips release eccentrically in a deadlift to lower the bar. After learning about the transferable skills between the deadlift and the volleyball pass, it is evident that practice of either skill can assist in the performance of the other.